With me, I have Dr. Anshul Gupta, and we are going to be talking about triggers of thyroid autoimmunity. So, of course, Graves' disease and Hashimoto's. And we're also going to talk about how to address those triggers. And Dr. Gupta is going to really get into peptides as well. So, this is the first time I'll be covering peptides. And so excited also to learn a little bit more about peptides. And so Dr. Gupta is a best-selling author, speaker, researcher, and he's a world expert in Hashimoto's disease. He educates people worldwide on reversing Hashimoto's, and he's a board-certified family medicine physician with advanced certification in functional medicine, peptide therapy, and also fellowship trained in integrative medicine. He has worked at the prestigious Cleveland Clinic Department of Functional Medicine alongside Dr. Mark Hyman, and he has helped thousands of patients to reverse their health issues by using the concepts of functional medicine. And wow, a lot of credentials here. And also, he's on a mission to help 1 million people reverse their health conditions. And to achieve this mission, he has written a bestseller book called Reversing Hashimoto's. And he also has started a virtual functional medicine practice, a blog, as well as a YouTube channel so he can reach people from all over the world. And through his innovative approach through Hashimoto's disease, he has helped several patients to reverse their unresolved symptoms and live their life to their fullest. And he loves to spend time with his wife and 2 kids. And in his free time, enjoys traveling, hiking in the woods, and meditating in a quiet spot. And welcome. Thanks for joining us, Dr. Gupta.
Thank you so much for having me on the show. It's a privilege of being here.
Yeah, definitely a privilege to have you, and look forward to talking about, both Graves and Hashimoto. So your book is on reversing Hashimoto's, but of course, a lot of the information applies to both Graves and Hashimoto's, as well as other autoimmune conditions. And again, the peptides, like I said, I'm very excited to also learn more about peptides, which also could apply to both Graves and Hashimoto's. And so let's start out with your backstory. So, why did you decide to write your book, Reversing Hashimoto's?
So, actually, this all started off with my own health journey. So, after doing my family medicine residency, I was working in a very small private family medicine primary care job. Just like a couple of years into my work, I started having my own health issues. I was having this horrible stomach pain that will actually often cause me to double over because of the pain. Sometimes the pain was so severe that I even thought about going to the emergency room. But being the doctor itself, I knew that the emergency room doctors cannot do anything except for giving me pain medications. So I just bared through the pain. Being a doctor, I started taking some medications to fix it. It was not working. At that time, I thought, well, maybe I'm not smart enough. Maybe let me see more specialists who are smarter than me to fix my problem. So I saw specialist after specialist, gastroenterologist, allergy specialist, you name it. We did tons of testing, lab testing, like endoscopies, ultrasounds, everything came back normal. They added more medications in the hope that will be helpful. They had no idea what was going on with me. I kept on taking more medications, but I was still miserable. I was having more symptoms. I was feeling so tired and fatigued that I had to take a nap during the day just to function during the day. After my day was done, I was so fatigued or tired that like I was literally not able to function. I was gaining weight like crazy, even though I have not changed my diet. So at the time, I had no idea what to do. I was totally helpless and hopeless because nobody could not help me out. Then somebody actually introduced me to functional medicine. Hey, like you should go to these guys. These guys actually fix people who are not fixable by anybody. So that's where I started training into functional medicine. And then the first thing I did was that started figuring my triggers. So I had figured that, my trigger was some food sensitivities. Along with that, I had a lot of inflammation built into my system. So with a stepwise plan, I addressed those things. Within 1 month, my pain was gone. Within 6 months, I was off all medications. I lost 40 pounds. I had more energy in my system than I ever had before. I actually did even took like a 5K rugged maniac after having so much energy, which was totally unusual for me. So after having that phenomenal results with myself, then I decided, okay, I need to help people with this functional medicine model of care. So I actually started working in the Cleveland Clinic. Then at the time, I was seeing these Hashimoto's patients or thyroid disorder patients, and they were exactly like me. They were all going to doctors, they were all taking medications, their all lab work were normal, but they were miserable. They had all had brain fog issues, fatigue issues, weight gain problems, gut problems, and nobody knew how to fix them. And they wanted answers, but nobody was giving them answers. So that's where I decided I need to help these people. So I started a research journey into why these people are not feeling better. So I developed, after a research of doing for a couple of years, a three-step protocol through which, I was able to help a lot of Hashimoto's and thyroid disorder patients and help them to get their life back. So that's where I decided, okay, I now need to write a book because I wanted to share this message with the whole world. So that's where, I started writing the book, and finally the book came into being, and it is out now.
Wonderful. Thank you for sharing that. So in your book, I did as we chatted a little bit before starting the recording, I did go through your book, excellent book, and you talk about triggers, which triggers play a big role when it comes to all different autoimmune conditions. So again, even though the triggers, they apply definitely to Hashimoto's, but again, for people with Graves' disease listening or a different autoimmune condition, those triggers also apply. So I'd like to just like dive into like some of the different triggers, and if you could talk about the main triggers that you discussed in your book that could affect people with Hashimoto's, Graves, and other autoimmune conditions.
So with my research, what I found was that there are main five categories of triggers that basically are responsible for majority of the chronic conditions, whether that's thyroid or other autoimmune conditions. The first one is food sensitivity. Now we all know that food is medicine, but food at the same time can also be an important reason for causing problems. So now what we are seeing is that more and more people are being sensitive to certain foods, and those are the reason that we are getting triggers of various autoimmune conditions. So these food sensory triggers could be from gluten, from dairy, soy, corn, processed meat, and processed food. So and sugar. So all of those foods that we know that are causing triggers, for Hashimoto's and Graves. So that's the first big category of triggers that definitely people should be evaluated for. The second category of triggers is toxins. Now our world, is laden with toxins. Each and every day we have more and more toxins which are poured into our environment. And we now know that these toxins are a big triggers, for autoimmune conditions like Graves or Hashimoto's. They can be heavy metals like lead or mercury. They can be mold toxins. They can be environmental toxins like pesticides and all those things too. So that's the second big category. The third category is nutritional deficiencies. So our body needs certain vitamins and minerals to actually function properly, especially the thyroid gland. And if it doesn't get those vitamins and minerals, that again leads to a triggering of an autoimmune condition, whether that is deficiency of selenium or zinc or vitamin D or vitamin B12. All of those things can trigger, an autoimmune condition. So very important for us to know about them. The next set of triggers is stress and trauma. Our world today, like we are exposed to stress all the time, especially in the current scenario that, we have this COVID going around and everybody is so stressed out. So stress is a major reason, whether it's physical, emotional, mental, spiritual, any kind of stress that body goes through, that again triggers an autoimmune reaction and leads to these Hashimoto's and Graves' disease. So that's very important for people to know. Again, important stressor is post delivery. So a lot of females, after they deliver their child, like within a few months they start having these autoimmune conditions, especially Hashimoto. So that's again a very big trigger that we see. The last set of triggers is infections. So several infections have shown to be leading to Hashimoto's and Graves' disease, whether they are viral infections like Epstein-Barr virus, whether they are parasites in your gut, whether they are chronic infections like Lyme disease or other co-infections, or candida infection too. So all of those infections again can lead to a trigger of autoimmune conditions. So that's where I've identified these big five sets of triggers that leads to several autoimmune conditions, and every person who has an autoimmune condition should be evaluated for all of them.
When it comes to food, so certain foods like gluten can potentially trigger autoimmunity directly, but would you also agree that the problem with some foods too is not that it's a direct trigger of autoimmunity, but it can also increase intestinal permeability, cause a leaky gut, which is a factor in autoimmune conditions?
Absolutely. So leaky gut definitely, like in the recent years of research says that leaky gut starts, the autoimmune process, and several foods that we are eating definitely causes that leaky gut. So not only the bigger ones like gluten and things, but if you're eating any processed meat, or if you're eating like white flours, or if you're eating too much sugary foods or high glycemic index foods, those definitely can lead to again a leaky gut issue. And again, it also depends on how we are cooking our food. If you're overcooking our food, or we are charring our food, or we are frying our food, that again can lead to kind of increase intestinal permeability and also causes leaky gut. So definitely, like it's not only direct association but also an indirect effect on the intestinal permeability, which leads to leaky gut and also leads to this autoimmune condition.
And do you, when it comes to food sensitivities, do you test for food sensitivities, or do you put people through an elimination diet? How do you usually detect the food sensitivities?
So I do both, because there is no foolproof of knowing like if person is sensitive to food or not. We have several tests of food sensitivities, like all of them are great, but none of them is perfect. I have tried each and every of them, but still, like I feel they lack something. So that's where the food which I know that is not good for a person, I definitely do an elimination diet of 5 or 6 foods with them, and at the same time order the food sensitivity panel, and then that gives us a little bit more better idea of whether they are certainly very very sensitive to certain foods, and we can eliminate those also in the later phases.
Interesting. So you have everybody avoid the common allergens, the foods that you mentioned, the gluten, the dairy, the corn, the soy, the refined sugars, the processed meats. So everybody has to avoid that when they're under your care, or that's what you recommend for everyone who's under your care. And then on top of that, you do food sensitivity testing, correct?
Right, because it actually the timing works out pretty good, because when the person sees me for the first time, by the time we order the food sensitivity and we get the results, is anyways 3 to 4 weeks. And during this time, I take this opportunity of basically cleaning their whole system, and waiting for the test results. So that way, I do this elimination diet, which cleans up their system, and it is kind of brand new to function. And now the food sensitivity panel gives us a better fine-tuned direction of which way we need to go. So that way, it's a win-win situation for both the sides for me.
Okay. And is it IgG food sensitivity testing that you're doing?
Yeah, mainly IgG testing. We have different versions of things now. We have this MRT test, which is good. Obviously, we have this old traditional IgG testing also available. So it depends, because the MRT and the other tests, the newer ones could be really expensive. So it also depends on affordability factor. If people can afford it, then definitely I go with the more expensive ones. Which are not only look at the IgG but also looks at some of the other intermediate cytokines and histamine mediators, so that like increases the sensitivity of the test. So that's what now we are using instead of just the plain IgG.
So if you were given a choice, like you because you don't have people do both types of testing, so you would say number one would be MRT testing if they could afford the MRT test, and if not, then you would go towards the IgG test.
That's correct.
And before you have them eliminate those foods, like these are blood. Both of these are blood tests, IgG, and MRT. So do you
Mhm.
have them do the blood test first before giving up the gluten, the dairy, the corn, the soy, or right away you have them give it up? Because yeah, I mean you know about, at least with food sensitivity testing, you need to be eating the food for the test to be accurate. So I'm wondering if you just tell them, just keep on what keep eating the same foods, try to get the test as soon as possible, and then as soon as you get the blood draw, stop eating the gluten, the dairy, and the other allergens. I don't know if that's what
Exactly.
you take.
Yes, that's what exactly I do. Like I tell them, okay, if you want to do a food sensory test, then this is the right time to do it. I don't want you to kind of eliminate everything for 4 weeks or 6 weeks and then order the food sensitivity panel, because as you rightly pointed out, then it will be useless. It will not be very accurate. So then if they do decide to do the testing that I said, okay, get the blood work drawn and within the few days, get the testing done and then start the elimination diet. So that's typically that what we do with them.
Wonderful. Toxins. So talk a little bit about toxins. There are so many toxins. So I don't know if you do testing for some toxins. Obviously, we can't test for all of them. We could do some testing, some practitioners for heavy metals, and there are other tests as well for certain environmental toxins. But tell me what you do in your practice.
Right. So again, like basically start with a in-depth questionnaires and also in-depth, asking about what is their potential risk for exposures. So the big three categories of toxins, is like one is heavy metals, whether that is lead or mercury or arsenic or aluminum, those are the things. Then the second category is the mold toxins, and the third category is environmental toxins. So there are some clues that we can get, by patient's history that kind of points us towards where we might need to go. And once we get that, that's where the test I order it. What I'm seeing is that more and more my patients actually have mold toxins. Previously, I was relying on heavy metals as a main reason, but I think in the last couple of years, the shift has been more towards the mold toxins, and that's where has been the triggering factor for a lot of Hashimoto's. So like this patient of mine, like this is a 33-year-old female who came to see me for Hashimoto's, was diagnosed 5 years ago, was having horrible symptoms, for feeling so tired that she has to take two naps during the day just to be functional. Along with that, she was having brain fog, she was gaining weight, and she was on the right medication. She kept on going to her doctor, and her doctor said, okay, you are perfectly normal, nothing else could be done for you. And she was definitely disappointed. She wanted to do something else. So that's where she came to see me. In the first evaluation, when we were talking, I just started like asking about different toxin exposures. I said, tell me more about your house that you live in. She said, it's a nice house. I've been in this house for like last 10 years. I said, okay, well, how old is the house? And she said, the house is really old. It was in 60s. And then when I asked her, do you have any mold in the house? He said, no, there is no mold. I said, but can you smell moldy in your basement? And she said, yeah, I mean, my basement is moldy, but I don't see any mold. I said, bingo. So I said, yes, mold can be a trigger. I said, since when you moved in the house, did you notice that just a couple of years after that is where you got diagnosed with Hashimoto's? And she said, yeah, that was the situation with me. So I said, let's check you for mold. And obviously, we ordered the test, and the mold toxins were super high for her. And then she had no idea that mold was causing the trigger of her Hashimoto's, and actually, her house had mold toxins. So she did the remediation for her house. We, got her on a mold protocol. Within 4 to 5 months, she was just phenomenal. Her fatigue was gone. She was able to function during the whole day. Brain fog was gone. She lost like 18 pounds during the time. So she was like, wow, my life is totally back. And I had no idea. Nobody ever asked about me about whether that, mold toxins or anything could be wrong with me. So that's where, like these toxins are so important and a missing piece in the puzzle very often. So we should have a very high index of suspicion. But again, as you pointed out, there is no perfect test for toxins because there are so many toxins. Each and every day, we are just producing one new toxin in the market. But like I think with the careful history, a lot of the symptoms can point towards a person being toxic or not. And then I think ordering a test definitely confirm things for us.
And I'm sure you have your patients incorporate the basics, like making sure try to eat organic food to minimize, pesticides and herbicide exposure, and then drink purified water or some type of filtered water, and to
Mhm.
avoid the tap water and water out of plastic bottles. Correct?
Absolutely. Yes, those basics, like we talk about those, before we go on a hard detox, we actually open up, and help them out to clean up their environment as well as start working on the detox channels. So as you said, like, cleaning up their water, cleaning up their foods, cleaning up their cosmetics, because a lot of females are using a lot of cosmetic products which are heavy in a lot of chemicals. So working on that is very important. Working on air filters. Again, like a lot of us, like living in houses which have poor air ventilation system, and that again can lead to these problems. So working on proper air filters for that purposes, and then working on basic things, like dry brushing could be very useful for detox purposes. Working on saunas, again, if they're tolerated by patients, having them go to that. So those are like basic things. Drinking lots of water, having bowel movement, that's the perfect way to detox your body. And a lot of our patients are not having bowel movement. So incorporating those simple things, we start with those, and then we work on the hard detox. Where people actually falter is that without optimizing their detox things, they suddenly just start with a hard detox, and they get so many die-off reactions, and that's where actually people get worse. And that's always tell people is that let's make sure that we are doing it a stepwise plan where we know how to do it gently and how to do it safely. That's the key about detox.
Makes sense. I incorporate sauna. I talk about sauna. Not it's not something everybody could do because they either have to have a sauna or go somewhere for a sauna. So I don't necessarily start out everybody where I recommend sauna therapy, but yeah, you brought up some great points. And when it comes to the next trigger you mentioned is nutrient deficiencies, can you also talk about some of the more common nutrient deficiencies? The more, I mean, all nutrients are important, all vitamins, minerals are important, but the ones that relate more to autoimmunity, like selenium, I'm sure you'll talk about, which is one of the big ones. And then if you could also jump into like, how do you, or if you test for nutrient deficiencies, or do you just have everybody take like a high potency multivitamin?
Right. So yes, like nutrient deficiency is on a big rise. A lot of patients that come to see me, well, I don't think I'm deficient in any nutrients because I eat a healthy diet. Well, now research suggests that our food itself is deficient in minerals and vitamins. So there was a research study done which compared food from 1990s and then the food in the present scenario in 2020. And they actually saw that there was considerably lower amount of vitamins and minerals in the food that we are eating. So even though we are eating the best quality food, then also we might not be getting the nutrients that our body needs. So that's a very, very shocking revelation that I had, when I looked at the research study. So several vitamins and minerals are associated with autoimmunity. Vitamin D is a very common vitamin which almost everybody is deficient into. So very easy to check, but definitely that's one of the things that everybody should get checked into. The second one is selenium, especially for thyroid patients, whether Graves or whether, like they are Hashimoto's. Selenium is such an important mineral, and again, we are very, very low. Unfortunately, there are not many good sources of food for selenium, and that's the reason it is very important to kind of make sure that we are checking for selenium deficiency and things. Vitamin B12 again is very, very common, and like a lot of people are deficient in vitamin B12, especially people who are vegan or vegetarian. So we always make sure that we are checking for those things for them. So vitamin B12 is again very important. That definitely that we should be checking that out, and a very common trigger of autoimmunity that we should be looking into. Iron deficiency. That's another thing that we always kind of, especially in females of childbearing age, very common and often missed about. So that's another thing that we always want to kind of check and know about. So I think those are the most common minerals and things that I will say are associated with Hashimoto's and the Graves' disease. And obviously there are other things, like vitamin C, and which a lot of people can be low, and zinc they can be low about, magnesium they can be low into. But I think the other were definitely the first ones are definitely the foundational ones. Now, in terms of the checking them or whether I put them on multivitamins, so I definitely believe in kind of being more specific with my supplements. So instead of putting everybody on a multivitamin, I do these, like testing for them. And again, unfortunately, normal labs do not check for all the vitamins and minerals. So we do use specialized lab testing like Genova or SpectraCell, or other things, which gives us a better in-depth analysis of, like these all different vitamins and minerals. And then we curate a personalized plan and supplementing only what the body needs.
So you use either the NutriVal or the micronutrient testing through SpectraCell. Is
Yeah.
there one that you prefer over the other, just out of curiosity, or?
I like Genova, like because like they have been in the market for like forever, and I kind of believe in their quality that way. So I like Genova testing better than the SpectraCell.
And you also mentioned in your book when it comes to B12, so you don't want to rely on serum B12, which I'm glad you mentioned methylmalonic acid. So you and the NutriVal, I think, is both blood and urine, right? And that looks, I think,
Right.
at methylmalonic acid in the NutriVal. And from what I understand, I think urinary methylmalonic acid is supposed to be a little bit more accurate than the blood methylmalonic acid. I don't know if you've heard the same thing, but
That is correct. Yeah. And again, as I mentioned, like I rely on all these two or three different ways. You're looking at the B12 levels, looking at the MMA levels, as well as looking at the homocysteine levels, because that gives me a complete picture of where our B12 levels are and what's going on with the B12. And then, supplementing in the right form. Because sometimes, people, a lot of my Hashimoto's clients actually have pernicious anemia, which basically means that they are not absorbing B12 from their gut because they again have this autoimmune condition. So then we have to rely on either injections or either sublingual, B12, so that they can absorb it and they can do better. So I think B12 is such like in a complicated affair. It's just not as simple. Okay, well, yes, my B12 is low and I'm taking a B12 supplement, and they're fine with it. No, no, no. I tell them, okay, it's much more complicated. Let's just make sure that you're getting the right form of B12, and your body is actually converting and absorbing it.
When it comes to selenium, if you determine through testing, let's say that someone has a selenium deficiency, do you usually try to correct that through supplementation, or do you have them eat foods? Like I know you said there's not a lot of foods high in selenium, but a lot of people bring up the Brazil nuts. Well, can I just eat a few Brazil nuts instead of taking a supplement? So what response do you have when someone brings that up to you?
So selenium is one of the minerals which has the most research studies backing for thyroid disorder. Whether that is Graves, whether that is like Hashimoto's, whether there is hypothyroidism. Selenium is helpful for each of these things, and research actually proves that there are actually randomized control trials for it, which was wonderful. So, and then there is not much toxicity of selenium unless you're taking huge doses. So, whenever somebody comes with an autoimmune condition of thyroid, Hashimoto's, or Graves, then definitely I put them on selenium supplement so that help them out. Because again, as I said, I don't want to rely on food, just to get the selenium through that. And supplementation, I know that they're getting the required quantity so that we can actually help them to reverse, like and reduce the antibody levels through selenium.
I agree. I agree with everything you just said. Just because when you eat Brazil nuts, you don't know exactly how much selenium you're getting. So Brazil nut might have 10, 20 micrograms per nut, or sometimes it could have a lot higher, but you just don't know. And even if
Mhm.
it's organic, it still might not have like 70, 80 micrograms per Brazil nut. So you might not be getting enough just by having a few. So with the supplements, at least you know exactly how much you're getting. Obviously, you want to try to do as much through food whenever possible. But as you mentioned, selenium is so important for just overall health. But those with Graves and Hashimoto's, there is a lot of research when it comes to selenium. So let's talk about stress. So again, in your book, you did mention where you test, or I think I saw where you test cortisol in everybody, which I do too. I recommend adrenal testing. So can you talk more about the effects of stress on the body as a trigger and the testing? I don't know if you use, I don't remember if you put saliva testing or if you specifically mentioned what type of testing, but if you could get into that, that'd be great.
Yeah, so again, as you mentioned, stress is such an important trigger, and most of us always discount stress, as being, like nothing major, right? But we know that the research suggests that each and every autoimmune disease can, the big trigger can be stress. Now, what happens in stress, as we know about, is that stress basically kind of affects negatively impact our body in all different ways. But the major reason is about putting pressure on our adrenal glands and, like, secreting this cortisol hormone. Now, cortisol is a great hormone, it is very protective to our body. But when chronically this cortisol levels are high in our body, basically starts burning our body from inside out. There is a special connection between thyroid and, like our adrenal glands. So the thyroid gland actually, like helps with the adrenal functioning of the gland. And the cortisol actually helps with the thyroid functioning. But what it was seen was that chronically elevated cortisol actually causes a negative feedback to the thyroid gland to the point that it stops producing the thyroid hormone. So it creates like a scenario of hypothyroidism, while in reality there is none. The second thing cortisol does is that it plays around with our immunity. Cortisol can actually change around the inflammatory processes in our body and increase the inflammatory markers, which again triggers an autoimmune process and causes the Hashimoto's or Graves disease too. So that's the reason, like, this adrenals, are so important, and chronically elevated cortisol is very important to know whether that's a big trigger or not. Now, the easiest testing, is obviously the saliva cortisol testing. Now, the problem is that, the cortisol levels change during the whole day. Like, and if you just check cortisol levels just one time in the day, then it's not accurate. So we have to check it at least 4 point, like cortisol saliva testing to kind of know, like the accurate curve and where people are actually faltering.
Have you looked into, just out of curiosity, I do use saliva testing in my practice too, but I also over the last few years started for some patients using the Dutch testing, dried urine testing.
Yeah, Dutch is awesome. So if I'm kind of checking for all the hormones, then Dutch is great because that gives me a complete picture of their hormones, cortisol, estrogen, progesterone, metabolites, everything. Obviously, it's a little bit on the expensive side. If I'm just looking at the cortisol, and obviously my patient cannot afford the Dutch test, then we will go with the cheaper, the saliva testing. But definitely, if you ask me, the gold standard test right now to check for the hormones, whether males or females, and definitely Dutch testing is very accurate and gives us very nice picture about the whole complete kind of hormonal system. So absolutely, I love it.
Yeah, and I think you'd also agree that you need healthy adrenals to have healthy sex hormones. So even if someone can't afford Dutch tests, they could get a lot of value from doing the adrenal testing and just supporting adrenals. And some people might decide to test the hormones in the blood. So maybe do total and free testosterone, progesterone, estrogen in the blood if they can't afford the Dutch test. So it sounds like we're on the same page when it comes to looking at adrenals and the sex hormones. And so that leaves us with infections, which is the fifth and final trigger. And so you mentioned viruses, Lyme disease, parasites. So do you test for infections in your patients? Like, do you run blood testing for Epstein-Barr? Do you run a comprehensive stool panel, or does it depend on the person?
Again, it depends on the person to person, because obviously, like it just becomes overwhelming for, like, our clients to do so many testing. So we kind of, again, based on the questionnaire and based on the history, then we decide of where we need to go. So most of my clients end up doing a stool test, because like we know that leaky gut issues and SIBO, and there's so many other things which the gut can lead to an autoimmune condition. So stool test is very common, so that does cover the parasites. So that does take care of that stuff for me. Now the Lyme testing is, I do not order the Lyme test from get go, because Lyme is so difficult to treat, and that's like so way down the lane. Unless somebody comes to me and they've already done everything, and the only thing which is left behind is Lyme. So that's the last thing that I will check for my patients, because there is so much more that we need to do beforehand. Then comes the Epstein-Barr virus. So Epstein-Barr virus depends on person to person. If I get clear indications that they do have Epstein-Barr, if they have the history of it, we know that the Epstein-Barr virus is living in their body, and reactivation is very very common. So then, like most of the time, we our protocols are anyways building their immunity back, and that's where the peptides are useful, because they do help the immunity and stuff too. And so we address Epstein-Barr virus by building their immunity and working on it through peptides anyways.
How about H. pylori? Do you find that to be a problem with some people with thyroid autoimmunity?
Absolutely, yes. Like again, that's a good add-on test. For my stool test. Like that's what I kind of do an add-on and look for H. pylori. A lot of again folks, who have autoimmune conditions will have a positive H. pylori too. So absolutely, working on that definitely is very important and improves a lot of my folks, like health.
Let's dive into peptides. So you briefly mentioned peptides when talking about Epstein-Barr helping with the immune system, but before you get, I guess, into greater detail with peptides, can you just explain for those who are unfamiliar with peptides what they are?
Absolutely. So peptides are basically a collection of small chain amino acids which are naturally produced by our body. So we have proteins in our body which are long chain amino acids. And similarly, we have these peptide molecules which are produced by our body which are very, very small chain. The most common peptide that everybody knows about is insulin. So we have already been using insulin for a decade. That was the first peptide that we were able to harvest and use as a medicine. So now what happened was that with the recent advancement in the technology, we were actually able to harvest more and more peptides and make them stable. The problem that we were having with peptide was that they were not being stable. So as soon as we will harvest them, and when people will use them, they will become like just inactive. So now we are be able to combine them in different compounds and also have better technology so that we can actually have them as kind of medicines. So there are now some couple of new peptides which are also approved, for diabetes, which have already come to the market, and several other peptides are actually in the pipeline of getting final FDA approval to kind of for various diseases. So the good part about peptides is that they're pretty natural. Your body is already producing them, so we are not using any external medications. We are just using them in your body, so that for them having specific kind of therapeutic potential in them. There is not much downside about peptides. Most of the peptides have been not used like in the conventional medicine, but they have research behind them that shows that how safe they are. So now there are several peptides which definitely are useful in these situations, especially for Graves and Hashimoto, especially with autoimmune conditions. Now we at least have at least probably 30 peptides in the market, which we can get. But obviously not all of them are good for autoimmune patients. So we will just talk about a few of them which are useful for autoimmune patients. So the very first peptide which is useful is called BPC 157. Now this BPC 157 is naturally produced by our gut. So it is produced by our gut. It helps with healing. It helps with kind of keeping our gut in good shape. Now what we did was that when we were able to harvest the BPC, there have been tons of research studies to see its therapeutic potential. Now we discussed about leaky gut as being a potential trigger or actually starting point of a lot of people with Hashimoto's. Now BPC actually has shown to be improvement in the leaky gut as well as the gut permeability. So that's one benefit of BPC, that it definitely helps with the leaky gut. The second thing that we discussed about was that H. pylori, right, which can again be a trigger of a lot of Hashimoto's patients or Graves' disease patient. BPC again can be helpful for removing or actually fighting the H. pylori. So that's the second benefit of the BPC. The third benefit is the healing. A lot of people with Hashimoto's and Graves come with a lot of issues with like muscle injuries or joint pains or inflammation in their body with fibromyalgia like symptoms, and BPC again has shown to be improvement of those symptoms, especially for healing purposes, especially muscle injuries, ligamentous injuries, or joint issues. BPC is very, very great in that. So that's the third benefit of BPC that we see most oftenly. So that's where this BPC is a wonderful peptide, like it covers a whole bunch of things, especially gut is very important. It also supports a good gut microbiome. Most people, when they come to see us, they have this dysbiosis, where is an imbalance between the good and the bad bacteria. They have more bad bacteria as compared to the good. And BPC again, like because of the killing off of the bad bacteria that BPC does, it promotes the good bacteria, which again obviously shifts the gut microbiome towards a healthier side, and again helpful for the lot of autoimmune patients. No downside to BPC, very well tolerated, like no, literally no side effects, anybody can use it. So that's one of the first peptides that a lot of my clients get started on, to start kind of get the healing process on. The second peptide in this range is thymosin alpha 1. Now, thymosin alpha 1 is actually a peptide which is actually produced by our thymus glands. So we have these thymus glands in our body when we are born, and then like during the teenage years, these thymus glands produce all these good, like thymus stuff, which trains our immune system, and which helps us to kind of basically tackle all the infections when we get older. Now, as our age advances, this thymus gland basically goes away, and then so we don't have this thymosin kind of compound which our body produces. This thymosin alpha 1 has wonderful kind of properties. It basically, so again, coming back to Hashimoto's and also in Graves' disease, what is happening again is that our immune system goes towards a more Th1 response, which is like a Th1 situation is more inflammatory condition, which is present in majority of the autoimmune conditions, which is basically like we have this different kinds of immune cells like T cells and B cells and stuff, and basically those triggers like retrain our immune system to cause inflammation. The thymosin alpha 1 actually retrains the system and do the opposite. It basically kind of from inflammatory state, it actually reduces inflammation and rebalances our immune system. It actually retrains the T cells to again start behaving and doing the right thing. Thymosin alpha 1 is good for a lot of infections, whether that is Epstein-Barr virus infection, whether it is Lyme disease infection, even it basically because it helps with the immunity purposes. The second actually benefit of thymosin alpha 1 is actually it removes the reactive oxygen species. So what happens with a lot of toxins, especially the mold toxins, is that they cause mitochondrial destruction, and that leads to reactive oxygen species formation. These reactive oxygen species cause a lot of inflammation, which starts destroying your body. That produces more reactive oxygen species. So we basically go to the loop over here. Thymosin alpha 1 breaks that loop. It basically removes a lot of reactive oxygen species. It helps to reduce inflammation in the body. So that's the reason a lot of my clients which who have like toxin issues, which are very sensitive. Some of my clients are so sensitive that they could literally eat like two foods and they will have random reactions, mast cell reactions, hives and random kind of rashes all over their body. And those are the people that we start using thymosin alpha 1. And they're able to tolerate other supplements, or they were able to tolerate food or environment around them. So that's the beauty about thymosin alpha 1. It is useful for immunity, for fighting infections, for mold toxins, for reducing inflammation. Wonderful, wonderful peptide. Again, no downside to the thymosin alpha 1. It's very kind of, safe to use. Not much kind of, side effects that we have seen. The third peptide is thymosin beta. So again, like how I said, thymosin alpha is another peptide, which is produced by the thymus gland. The thymosin beta again is also an immunological peptide, which again helps with the immunity. Now, this one is actually important for repair. So if people, have chronic issues with like, gut leaky gut problems, or they have problems with, like joint problems or muscle injuries and things, then thymosin beta is wonderful. Again, is helps with the immunity, so helpful for fighting chronic infections, especially Lyme diseases. So people who have been on Lyme protocol with like antibiotics for a long time and still the Lyme doesn't go away, the thymosin beta can be very, very useful, because it actually goes inside the cells, and that's where a lot of time the Lyme hides. Lyme is not outside, it's actually inside the cells and causes reactivation. So this goes inside the cells and helps to kill the Lyme over there. So it's very, very useful and potent for that. So this is the third peptide that is useful. The fourth one, which is kind of a double-edged sword, like is called LL37. So this is an antimicrobial peptide. Basically, it helps to kind of boost the immunity, as well as helpful to killing a lot of pathogens that our body might be exposed to, which again is wonderful for Lyme disease. It is wonderful again for mold patients, for parasites, for people in general who have very poor immunity in general. So this is a good peptide to use for them. Now, the caution with LL37 is that if somebody is having an acute flare up of an autoimmune reaction, this is not the best peptide, because it's an antimicrobial and definitely can kind of flare up or worsen the flare up of the autoimmune reaction. So we don't want to use it into an acute flare up. But otherwise, for chronic of my patients who have been no flare ups, but are chronically infected or just not getting better, LL37 can again be very, very useful.
Yeah, why is that? Is it increasing that Th1 response, or?
So it doesn't do exactly the Th1 response. We don't know that. But, like we have seen triggers, basically what we feel is that because it's, improving the immunity of the body and kind of helping to fight off the infection, because a person is in the flare up, this even increase in the immunity actually further feeds the fire, into a flare up, and can sometimes lead to worsen things. Now, we don't see it very often, but again, my first motto is that do no harm. So that's the reason I'm always on the cautious side. Okay, if it can do any harm, let's just not use it. That's the way I feel about it.
As far as the administration, are they all administered the same way? Like, how are they administered? Are they administered via injection, all of them, or can you take some of them orally?
So majority of them are through injections, unfortunately. Okay, because again, orally they are not very stable. Once they go into the gut, they get destroyed over there. So that is the problem. So but the injections are very simple, like how people give insulin shots to themselves in their stomach every day. So that's the way people do it. Very teeny tiny needles. Most of my patients are able to do it on their own. So that's the way, like majority of the peptides are being used. Now we have a couple of peptides, especially the BPC. We have oral capsules of BPC. So people who have leaky gut issues, or people who are going through gastritis or GERD issues or H. pylori issues, we actually use the oral form of BPC, because again that works in the gut better and actually helps them out. But BPC is the only one which is in the capsule form right now. All the others are actually in the injectable form, unfortunately.
Good to know, and very interesting. I found all this interesting, but especially with Lyme disease, you said that peptide that could help in the eradication of Lyme disease. So it actually kills the Borrelia. It goes intracellular, as far as they know.
Yeah, that's what they, like as far as they know. I mean, obviously there's no human trials and stuff, but a lot of them are lab trials, like in animal trials that they have done. And again, very promising results that they have seen. Again, it doesn't work in the acute infection, but it is what we are talking about is a more chronic Lyme, because that's the one which is laying dormant, like in our cells, and making very subtle changes, to our immune system, being even in the smaller amount of it. So then this actually goes intracellularly, because a lot of these peptides actually work not only the cellular level, but inside actually the nucleus of the cells, because that's where a lot of these good organelles are present, because a lot of these, like chronic infection like Lyme and stuff, they're actually working directly on our DNA and RNA and changing the messages from there, which actually changes our whole immune system. And by changing the whole immune system, they are actually creating an inflammatory process. So they are not active infections as we know about them. These are basically subtle changes that they do in the inside machinery of our body. And that actually ultimately downstream effect of that is creating inflammation and creating autoimmunity. So these peptides, as they can directly enter the cell and actually go directly into the nucleus, they actually does the opposite and takes care of these Lyme and chronic infections.
Wonderful. Well, thank you so much for sharing. A lot of interesting information overall with the triggers and then diving into the peptides. So before we wrap this up and you tell people how they could get in contact with you, are there any questions that I didn't ask about triggers and peptides that I should have asked, or anything else that you want to say? Any last words?
No, I think we covered almost everything. We covered all the triggers. Obviously, there's so much more information that people can have. But I think, like what people should be knowing about is a high level idea of what are the triggers that they should be looking forward to, and then what are their options of getting rid of those triggers. So that's the most important thing that people should be knowing about. And I always like to tell each and every person is that there is hope for you to get better. Do not give up. Do not let anybody tell you that this is the life that you will be leading, for the rest of your life. There is hope for you to get better. You just need to find the right person and you need to find the right trigger and work on it.
Definitely agree with that, Dr. Gupta. Thanks again for sharing this information. And where can people find out more about you?
Yeah, so I have a virtual functional medicine practice, so people can actually work with me from wherever they are in the country. My website is called anshulguptamd.com. I have tons of information over there. Right now, I'm actually offering a limited number of free evaluation calls to my clients so that they can kind of, get to know more about how I work with them and how my protocols can be helpful for them. So they can again go on my website called anshulguptamd.com and click on the link which says free evaluation calls, and that will be great. I do have an active YouTube channel, so I share a lot of videos over there. I'm on Instagram. I'm also on like Facebook, so definitely people can find me on social media channels to get more information about Hashimoto's, thyroid, and all that stuff.
Don't forget your book. So Amazon or reversing-hashimotobook.com is what I have.
That's correct. Yes. So we have a website for it, reversing Hashimoto's book.com. So people can go over there and, buy the book. They can, my book is also available on Amazon. Just put reversing Hashimoto's. The book will be over there. You can order it from there. My website also has information about the book. So, all those places you can find it.
And I'll definitely include the links in the show notes for the podcast. And yeah, so thank you. Thank you again. Thank you so much for agreeing to discuss triggers as well as peptides. And definitely check out Dr. Gupta's book, and as well as visiting his website and YouTube channel. And again, thanks a lot, Dr. Gupta. Appreciate your time and the information you shared with everyone.
Thank you so much. It was really a pleasure talking to you. You're doing so much great work. Like I keep listening to your podcast, keep learning things, but it was really a pleasure coming over here and talking about like all these things.
Yes, definitely. And I'm sure everyone who listens found the information to be valuable. And again, thanks again and take care.
You too. Take care.